on, and please, if anyone has questions as we're talking here, feel free to put them in the chat box. We had a question from Karen Sarwanka, who's our good friend in Manitoba. Is there any advantage, it was during Martine's presentation, is there any advantage to framing intervention points as an issue or as a problem versus framing opportunities to realize aspirations? So, you know, what about framing it as the human right to housing as an aspiration? You know, is there a practical difference in how it's phrased, or is it semantics and wording? How important is that? And actually anyone could really speak to this.
That's a very good question. I don't have an answer. I think it speaks a bit to the more sort of positive health kind of why are we always defining health in a negative way? We should probably define it in a more positive way and try to analyze it in sort of that way. I really don't have an answer.
That's okay. Amanda, do you have any thoughts on that?
I agree. It is a good question. It is something that's sort of difficult to distill down. In some aspects, do I think that there is some similarities? Not to say that they're synonyms or that it completely distills down to semantics. But what I would perhaps say is that it sort of reflects a lot of the misinterpretation, or perhaps it's a little bit of a window into maybe a misunderstanding of some of the work that us as health promoters do, because I find that those words are used interchangeably a lot by other colleagues or other organizations that I connect with. And so maybe having some of the clarity around those of what we actually do mean by some of those specific terms, because that could be helpful in engaging in some of those conversations.
Yeah, and I think too, from my perspective, it depends a little bit on who your audience is or who you're communicating with at any given time, and what's their frame of reference. So if their frame of reference is, you know, there's a problem, there's an issue that needs a solution, that might be actually where you start. I mean, ultimately, we do want to get it to the point of realizing aspirations and framing it like, where are the opportunities? Because I think in general we're really good at pointing out where the problems are. we're a little more challenged to point out what we should do or what the opportunities are. But sometimes if we start where our audience or where whoever our partner is, if they're in the frame of thinking of this is an issue, this is a problem, and then we shift it, it just might be different ways of framing depending on who it is. Okay, we do have another question. I'm going to move us a little bit quickly through. We had a question from Calpita, and I think they were wondering about resources, research done on the interaction between the different entry points. And Martine, I noticed, I think you responded to someone else a similar comment that you would share some resources on entry points and on collective lifestyles, or collective, yes, did I get that right?
Yep.
Yes, collective lifestyles.
I can share some resources on all of the different entry points.
Sure.
But research specifically on the interactions between the different entry points, I don't recall seeing anything out there. But what I meant by saying that the different entry points are kind of interrelated is that some people will start focusing on settings, for instance, but then they'll actually, by focusing on school settings, for instance, are actually focusing on children, which is also a population or a specific group. And within that setting, people might actually be focusing on healthy eating in school. So that's a focus on a different entry point, which is not only the setting, but it's also the issue or the risk factor. So that's kind of what I meant earlier by saying that the distinctions that I made between the different entry points were kind of artificial, because everything is in everything.
it intersects, right? It intersects that many along the way. Yeah. Okay. I'm just looking through. You're going to share some readings on collective lifestyles. There is also a list of references at the end of this chapter in the book, right, that can provide some of the background research as well. There's a bit of comment here at the end around relationship building and the importance of that. Someone has asked, are social structures and relationships the new entry point? And we've had a couple of comments since then, but part of me would say yes. And is it that it's a new entry point, or is it that it's the underlying foundation of all the entry points?
From my personal perspective, again, I'm not stating this like in a scholarly capacity, but I think that the relationship building is core. And I know there was a comment in the chat around sort of the slide around relationship building as a core competency. And I just want to sort of reference that or refer back to that. So again, one of the benefits of being part of Health Promotion Canada is having access to a lot of the tools that are in the Health Promoter Toolkit. But when it comes to relationships, they actually are built right into the Health Promoter core competencies at the highest level, at level 2 competencies. And they're mentioned in, relationship building is actually mentioned in a couple of different competencies, 5.1 and 6.1. So those specific competencies, I think, are really critical in the broader aspect of how health promoters can increase their level of competency, because I think the core competencies are wonderful, something that I very much have spent a lot of time with. Yep. So it's critical to moving it forward, but while there's lots of tools in the toolkit, what I think it speaks to, those particular core competencies, is it's not only about creating these right health promotion positions, because as Irv mentioned at the beginning, some of the barriers that we might come up against is the erosion of health promoter positions or how they're actually positioned within different systems, the sort of downgrading of them at the sake of other healthcare services. But really, it's not only creating the positions, but having the right health promoter in the right position. And having those different aspects, which is because where I think we can kind of leverage. It's a very specific skill base to be able to develop relationships. I know that a lot of times it may seem tangential, but really it is a skill that can be built. And while it may be difficult to measure in sort of that quantitative sense, I think there are tools with, as mentioned, like sort of that sort of community capacity building approach, all those sorts of things can add to making it measurable so that we are able to have that type of solid evidence base.
For sure. And with that, we are unfortunately at the end of our time. So thank you for that. I do want to just say a couple of things. We had a last comment here from Jabindra around diversity focuses on a group of individuals with the perception that that group will have similar health concerns. And, you know, by focusing on health equity, you're focusing on what barriers impede health. And, you know, that was a key message in the chapter, that, you know, people's ability to actually conform with legislation, for example, so, you know, no smoking legislation, or, you know, other social and lifestyle practices, you know, that is really a function of their cultural, social, structural context in which they live, that the realities of choice are very different for different groups. I have put up a link to a freshly published article by Jeff Masuda and Erica Phipps on equity-focused intersectoral practice. And two of the things they say in there are, you know, if the marker of success is the number of organizations that participate, instead of the relationships built, there needs to be a rethink. That really the quality of the relationships built is the marker of success. And it's, you know, we have to move beyond who we reach out to and who we invite in. It's more about whose trust have we earned. so that we can serve as their collaborators and we can serve as their allies. And, relationships really at the heart of that. So with that, I am going to thank all of you for being part of this webinar today. Please complete the evaluation survey that is there and give us some good, deep, and honest feedback. And I really want to thank all of our speakers, Irv Rootman, Leslie Dyke, Martine, Shareck,